Welcome to Fertile Talks with Dr. Yemi Famuyiwa, a space where science meets the soul of fertility. Today's episode is proudly sponsored by Montgomery Fertility Center, a unique concierge fertility practice in Rockville, Maryland. At Montgomery Fertility Center, we combine compassion with precision science to meet every individual's need. It is a place where you'll feel heard, supported, and truly cared for. If you're ready to begin your fertility journey or just need clarity on your next steps, give us a call at 301-946-6962 or visit us online at montgomeryfertilitycenter.com. And before we begin, I want to share something close to my heart. My upcoming book, The Quest for Fertility, coming spring of 2026. This is a must-read for anyone preparing for fertility, thinking about preserving it, or supporting someone on that path. What makes this book special is that it goes beyond the science. It's soulful, a story-driven exploration of real patients' journeys and how they found hope, healing, and strength through fertility challenges. If you'd like to join our Quest for Fertility support circle or get updates about the book's release, visit montgomeryfertilitycenter.com and send us an email. Now, let's dive into today's episode of Fertile Talks, where we'll explore the science, stories, and soul behind the journey to parenthood. Good evening, everyone. This is Dr. Famuyiwa with another episode of Fertile Talks. And tonight I want to focus on something that's rarely talked about, and that is sexually transmitted infections and fertility. This is a cause of infertility that has been growing worldwide, enough that the World Health Organization made comment about it in its first ever worldwide statement. So the thing with sexually transmitted infections is usually they are very, very silent, and not all of them are symptomatic. That's why they're silent, right? So one of the most common cause of sexually transmitted infections is chlamydia. Chlamydia, we have about 4 million new cases of chlamydia every year in the U.S., according to the CDC, and that's probably an underrepresentation because it may not have any symptoms, and if there are no symptoms, it's not reported. If it's not reported, it's not diagnosed, and it's not treated. 70% of those who have unsuspected chlamydia will go ahead and have fertility issues in the future. And I'm going to talk to you a little bit about how that happens. The other prevalent infection is gonorrhea. Gonorrhea is riding right up there with chlamydia. We have about 1.6 new cases of gonorrhea every single year. About half of those are also asymptomatic. Most of the time, the damage is caused because they infect the cervix. I'll show you a little cervix here. So if you're looking on YouTube, you'll see me hold a uterus and of a mold of the uterus. So the infection usually starts in the upper part of the vagina at the entrance of the uterus called the cervix. The key thing is it starts there, but then it ascends into the uterus, and it can ascend into the fallopian tubes, and that's why they can cause problems. So most of the time, if it causes symptoms, patients may have pain, severe inflammation, they get treated, right? But if there are no symptoms and this infection persists, then the body tries to intervene and it sets up an immune reaction to try to attack it. But then you have collateral damage. Whenever the body decides to clear something up, you could get collateral damage. And the collateral damage is you could damage the tube from this immune response. Well, why do we care if you damage your tube? If the tube is damaged, the egg from the ovary cannot get into the fallopian tube. Sperm come from below cannot communicate with such eggs, right? Because there's scarring in the uterus, right? So we call that tubal factor. And sometimes this can, if it gets really bad, you'll get a, pus in there. That's the obvious PID. Now, the other damage that can happen is it could be a partial blockage. And if it's a partial blockage, that can even be worse, because if the egg gets picked up, gets fertilized, the partially damaged tube cannot do what it's supposed to do, which is move the embryo to the cavity. So it sets up the embryo to grow in the tube. That's a life-threatening infection called an ectopic pregnancy. So the thing is, this damage doesn't happen overnight. That's why it's so dangerous, right? This immune damage can happen over years. So people don't even know they have a problem with their tube. And if they get re-exposed, they get another infection, then it just accelerates the damage happening. So in my book coming out, The Quest for Fertility, I talk about patients who have come to see me much later along in their life and find out their tubes were blocked. They had an infection they never knew, and of course was never treated. So there are devastating consequences. That is one of the recommendations by both the CDC and the World Health Organization, is that all sexually active young women and older women who are at risk should undergo routine screening. It should just be par for the course, routine screening. Another infection that's not often talked about is, before I leave chlamydia and gonorrhea, so we know about tubal damage in women and about tubal infertility. It can also cause chronic pain. In men, it can cause inflammation of the epididymis in the testes, and that can impair the ability of the testicles to store and carry sperm. And it can also affect the sperm quality and motility. It can decrease also sperm count. So what are the other infections that could be out there? Other infections include syphilis. Mm-hmm. Now, syphilis, this one's really dangerous because if it goes untreated, it can cause nervous system damage, right? So it even has graver consequences. If it's contracted during pregnancy, it can lead to miscarriage, stillborn, and severe health problems in the newborn. The other infection is HPV, human papillomavirus. That typically doesn't directly result in infertility. However, it can result in cervical cancer or precancerous cells in women if it's not promptly treated. So the issue to recognize is that prevention, just preventing this at an early stage, can avert serious consequences and a lot of heartache much later on when the damage has been set in. How can you prevent it? Regular screening, like I mentioned, most of these are asymptomatic, and regular screening can pick up some of these and get it treated. Safer sex practices, effective use of condoms is a way to reduce your chances of contracting an STI. And then once it's detected, the key thing is prompt treatment. And of course, if anyone who's had an STI in the past should seek fertility evaluation as they get older. Now, a rarer form of infection that came up in my practice recently was tuberculosis in the uterus. Now, that is not necessarily a sexually transmitted infection, but it can spread to the uterus and cause consequences such as miscarriage or problems with implantation. So I talk about all this, and I also go into in-depth on the mechanism of how this happens in my book called The Quest for Fertility that will be coming out in March. So stay tuned. And if you like this information, if it's resonating, if you find it helpful, or you know anyone who it may help, just subscribe, press like, and share it. Share it with your network and let me know. Thank you so much. And this is Dr. Famuyiwa again with another episode of Fertile Talks. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.